everyone, so let's move towards our today's topic, which is,
as the name indicate, cardiac, और cardiac means heart and heart obviously दिल को कहते हैं. तो अगर वो फेल हो रहा है, failure, that means that the ability of a heart will be decreased, or in other words we can also say that heart is not functioning properly, that will lead to cardiac failure. Now बहुत सारे इसकी चीज़ें हैं. If the heart is unable to contract, then it is known as systolic heart failure. That means systolic heart failure means that it is not pumping properly. Okay, if it is not pumping properly, that will lead to the storage of the blood inside the heart. Okay, and heart cannot be emptied properly. Okay. Now, another point is, if heart is unable to relax and fill properly, that is known as diastolic heart failure. And diastolic heart failure is common in women. Okay, remember this point. Now, what is forward and backward heart failure? Forward means आगे, backward means पीछे. I will tell you a shortcut that you have to remember this forward and backward heart failure in लेफ्ट वेंट्रिकल. ओके, जस्ट इमेजिन लेफ्ट वेंट्रिकल. लेफ्ट वेंट्रिकल से ब्लड फॉरवर्ड अगर हम बात करें आगे, तो कहाँ जाता है ब्लड? एओर्टा में. ओके, दैट इज कार्डियक आउटपुट. ओके, और अगर हम लेफ्ट वेंट्रिकल से पीछे की बात करें तो वहाँ लेफ्ट वेंट्रिकल में ब्लड कहाँ से आता है? लेफ्ट एट्रियम से. लेफ्ट एट्रियम में ब्लड कहाँ से आता है? लंग्स में. लंग्स में ब्लड कहाँ से आता है? राइट एट्रियम में. राइट वेंट्रिकल राइट एट्रियम से. So that is known as venous circulation. Okay. Now, forward heart failure will cause decreased cardiac output. That means the heart is not pumping properly, due to which the body is not getting enough blood. Okay, and that is due to forward heart failure. Backward heart failure is when the heart is not emptied properly. That will cause backward heart failure. That will lead to increase in the pressure in the left atrium, then pulmonary veins, then pulmonary veins, then lungs, and then the right atrium, then right ventricle. So this is the topic you have to remember in the upcoming type, that is heart consists of left-sided heart failure and right-sided heart failure. So usually left side heart failure occur, and that will lead to right side heart failure. How I will explain you. Okay, now left side heart failure, like I said, it is common, and it can cause right side heart failure. It can cause pleural effusion. Okay, what is pleural effusion? Fluid inside the lungs. Remember, if the left ventricle, left atrium is unable to pump the blood in forward in the aorta, that will lead to the storage of the blood inside the heart, and due to storage, pressure will increase. That pressure will increase, and it increase rapidly. That will lead to the storage of the blood inside the lungs. Okay, and that fluid inside the pleural cavity, or pleural cavity, like we have already understand that topic in the respiratory module, that in respo module we have studied that pleural effusion is that when the pleural fluid in the pleural cavity will increase. And how it will increase? When the blood inside or lymphatic channel will open, and backflow of the blood will occur, due to which the blood will store inside the pleural cavity. That will lead to pleural effusion. So you have to link this topic as well. Now, left side heart failure is due to ischemic heart disease or coronary heart disease. Valve problem. लेफ्ट साइड में कौन से वेल्व होते हैं? बाइकस्पिड वेल्व और सेमिल्यूनल वेल्व. ओके, बाइकस्पिड और माइट्रल वाल्व. It can also due to myocardium disease. If the myocardium muscles are not getting enough oxygen due to hypoxia, they will lead to left side heart failure. Now, what are the symptoms? Symptoms are dyspnea, orthopnea, cardiomegaly. Cardiomegaly means increase the size of the heart. Tachycardia, increase the blood pressure. Third heart sound will be listened in this left side heart failure S3, and we have already talked about heart sound in the separate recording. You can listen that. And left side heart failure can lead to death. Okay, and obviously if it is causing pleural effusion, you can listen that rels at the base of the lungs because of the fluid. What are the rel sound? Rel sound are the bubbling sound. Okay. Now, like I said in the symptoms that orthopnea, after dyspnea I said orthopnea. Dyspnea is the shortness of breath. But orthopnea is the type of dyspnea in which there is a shortness of breath when the person is sleeping or is lying or is lying on the flat surface. When a person lie on a flat surface, or if a person sit on any surface, that is known as, and that cause shortness of breath, that is known as orthopnea. Now, right-sided heart failure, like I said, it can cause by left-sided heart failure, or it can also cause by respiratory diseases, or obviously it can also cause by valve problem, and the right side valve is tricuspid valve. Good. Now, it can cause cor pulmonale. What is cor pulmonale? Cor pulmonale is basically COR is chronic obstructive. Cor is basically is the word which is used instead of heart. So cor means heart, COR means heart. Okay. Now it will lead to increase in the size of the right atrium or right ventricle of the heart. And why it occurs, why the size will increase? Because of the pulmonary veins pressure, or pulmonary artery pressure, or you can also say that venous circulation pressure. Now, what are the symptoms? What will be the symptom for the right side heart failure? Liver, spleen will be enlarged. Liver will be enlarged. It will due to edema, if there is edema. Now link that concept. What I am saying, that left side heart failure can lead to right side heart failure. Now remember, left side, when the left side of the heart will fail, it will cause edema in the lungs. Okay, when there will be edema in the lungs, it will lead to increased pressure in the pulmonary vein. It will cause backward flow, and it will lead the pressure, and it cause the pressure inside the right side of the heart. That will lead to right-sided heart failure. When there is both side heart failure, that is right side as well as left side, they are known as biventricular heart failure. Okay, so remember this point clearly. Now this is the whole topic. So guys, take care of yourself and study hard, work hard, and good luck. Bye.